So the BASECAMP study, which is in partnership with A2 Therapeutics, is really to try to develop a next generation strategy for CAR T therapy for solid tumors. The therapy is based on a strategy of selectivity, where there's a approach called Tmod, which uses a receptor system that helps CAR T bind to specific cells expressing surface antigens, and in the same construct expresses a blocker so that you can deliver a high-level payload with CAR T therapy while having the ability to mitigate off-target effects. This general strategy first will use HLA-A2 as a biomarker for entry. This is an HLA subtype that's represented about 30% of the U.S. population. So they started off with an HLA subtype that's the most commonly expressed HLA. And there, the goal is to take patients with certain tumor types, and we've been focusing on pancreas, high-risk lung, high-risk colon, and are soon to be expanding into ovarian and head and neck cancers. And we do HLA testing in patients that are at either very high risk for recurrence of disease, or if they have metastatic disease, and they're in a position to consider CAR T therapy. If they're the right HLA type, then their tumor is evaluated for HLA status, and specifically we're looking for LOH of the HLA allele in their tumor. And that would, if present, then they qualify for the study. If they do have HLA LOH in their tumor, then they're candidates for leukapheresis, where cell product is obtained and then sent to A2, where the T cells are isolated and genetically manipulated such that a CAR T product is available when the patient should need it. So overall, it's a very exciting strategy and a new opportunity for patients who have solid tumors where perhaps standard immunotherapy has not been shown to be efficacious, but here we may be able to use the immune system to help patients fight their own cancers.